are becoming more and more apparent as the current generation is aging. Today we're very fortunate to have Dr. Julie Lounds Taylor from Vanderbilt Kennedy Center speak to us on transition issues with her webinar for us today on When Children with Autism Grow Up. Near the end, we will also have a couple of discussants joining us, Dr. Alice Koo and Dr. Patience White. So at this point, I'm going to turn things over to Dr. Taylor.
All right. Well, thank you, Dan, for inviting me to come and speak with you today. Looking forward to sharing my research and hopefully having a lively discussion about what people are seeing about children with autism when they transition to adulthood. So I'm going to be talking about understanding the challenges faced by individuals with ASD during the transition to adulthood and beyond. Before we get started, I'd like to take a minute. I'm realizing as I get into this research that when people think about the transition to adulthood, mostly people come into a presentation like this with ideas about what they think they're going to hear presented on based on sort of their background and experience. So I'm going to tell you a little bit about what I will not be talking about, and then I'll tell you a little bit about what I will be talking about. So I'm not going to be talking much about medical transition out of pediatric care to adult care. I'm a developmental psychologist, not a physician, and that's sort of not what I'll be talking about here, although fortunately we have Alice Koo and Patience White who will be able to speak to these topics with much more expertise than I could ever begin to attempt to talk about them. So we can certainly spend some time on those issues, but that's not going to be a part of this presentation. I'm not an epidemiologist or a services epidemiologist, so I'm not going to be talking much about kind of population level stats about kind of what are people with autism doing or what services people are getting. And I'm also not a special educator, so I'm not going to really be talking very much about what happens in the school system in terms of transition planning and things of that sort. Instead, I'm going to be telling you a little bit about some of the work that we've been doing where we've taken a relatively large sample of people with ASD and their families and looked very carefully in pretty great detail at what happens, what do their lives look like during the transition to adulthood and beyond for both them and their families, and what are we learning about people who seem to be most at risk at this time and people who seem to be functioning relatively well during the transition to adulthood. Okay, now I'm going to see if I can figure out how to advance the slides myself. I'll try again here. There we go. So traditionally, a lot of our research and media attention has really focused on autism in early childhood, and these magazine covers are getting a little dated now, but they're kind of a sampling of what people tend to think of when they think of people with autism. They tend to think of young, cute kids, and a lot of our research has reflected this bias. A lot of what we've learned and what we know about people with autism has really focused, I think, a lot on early intervention, has focused a lot on also genetics work in terms of what might cause autism. These are very, very important things to study, and we have learned a lot, not only about the best ways to think about intervening and helping children with autism kind of reach their maximum potential, but also we're learning a lot about what the causes of autism might be. But it really is only part of the picture because children with autism, of course, grow up to be adults with autism who continue to have support needs. We are, I would say, in the last 5 years or so, really beginning to see increased media attention paid to autism in adulthood and some of these issues that are faced by people with ASD in adulthood. This is just one example that I pulled out that those of us in the field were sort of excited about. It was a front page story in the New York Times, even above the fold, which is a very big deal, of course. And it told a really nicely written story that told about a young man with autism, I believe he had Asperger's, who was getting ready to leave high school. And it spoke, I think, very carefully about the struggles that he was facing in terms of independence and in terms of thinking about what was going to come next after high school exit. We see more and more stories like this lately. I think the increase that I think reflects increased media attention and thinking about what happens beyond childhood for people with ASD. This is also reflected in funding for research in ASD. These are just research emphasis or research priorities for Autism Speaks and for the Interagency Autism Coordinating Committee. I pulled out their statements in 2011 because that was right around the time when we first start to see adults show up in research emphases and in strategic questions. So for Autism Speaks, the question was understanding the factors that influence quality of life for adults. And for the IACC, it was even a little bit more basic than that in terms of understanding what in the world does the future hold for adults with ASD. So because we are seeing more, I think, research money and research money put aside for individuals in this age range, we're really starting to learn a lot, and it's bringing more attention to this area. And one of the reasons why we see so much more attention focused on ASD in adults is because there are more and more youth with ASD who are leaving high school and entering adulthood. So this is just a slide that shows Prevalence Studies starting in 1975 and going up to 2009 was the most recent in the slide. We can see that around 1995 here, right around here or so, we start to see the prevalence rates of ASD going up. And children who were diagnosed right around that time are now getting to be the age where they are leaving high school. So our adult service system at this point is really underfunded to meet the needs, oops, let me get on here, to meet the needs of this many adults with ASD. And we are going to see those numbers going up more and more and more as more and more children with ASD age into adulthood. And it's a real concern. Okay. So let me get in a little bit into what I will be talking about specifically today. I'm going to spend a little bit of time at the beginning here talking about the developmental and psychosocial changes that take place for youth with ASD during the transition to adulthood, really focusing in on the transition years and particularly what behavioral and family changes do we see during this time. Then I'm going to move down the lifespan a little bit, and I'm going to talk about the challenges faced by individuals with ASD throughout adulthood. I'm going to focus in on vocational and educational outcomes specifically, and I'm going to talk a bit about whether these difficulties at transition are going to signify what we call a momentary perturbation or a shift of trajectory, and I'm going to talk a lot more about what that means down the road a little bit. If we have time, I'm going to talk a little bit about kind of our current research about ways to promote better transition outcomes as well as other research that's out there. I'm actually guessing that we're not going to have time to get to this, and that's fine. We can always talk about it during the discussion or the question and answer if people are really interested. Okay, and before we get into the research, I also want to say, and I always want to make it clear that although a lot of the data that I'm going to present, particularly in the second part of the talk, are really focused around employment and post-secondary education, I am well aware that transition success is much more than does somebody with ASD have a job, have they gone to school. Transition success is not just employment or schooling for anybody, and that is certainly also the case for people with ASD. I have a slide at the very end, which I most certainly will not get to, that shows a survey that we did where we asked families of people with disabilities, what would you consider to be a successful transition to adulthood? And we got wide-ranging answers, and certainly employment and living independently and school were all mentioned and were important pieces. But of course, there was connectedness and being a part of a community, friendships, romantic relationships, being happy, being healthy, transportation. I think we ended up with something like 15 categories of different types of indicators of a successful transition that parents brought up. So I'm going to focus in, and particularly in the second part, on employment and post-secondary education. But just know that I am well aware that that is a very small slice of the transition success pie here. And again, I'm coming at this as a psychologist. I'm not going to be talking very much about what's going on in the schools, what's going on in the clinics, or what's going on a population level. Okay, so what developmental and psychosocial changes take place for youth with ASD during the transition to adulthood? Okay, as I started to get into this area of research, I realized that even something that seems as basic as defining what we mean by the transition to adulthood is not necessarily so straightforward. So the traditional view that's been out there, particularly in developmental psychology for a very long time, about what it means for somebody to transition to adulthood is that somebody would complete a number of what these would be called like developmental tasks of adulthood. And once somebody has completed these tasks, they have officially successfully transitioned. And so these would be things like graduating from school, moving out of the parental home, getting a job, getting married, and having children. But I'm sure as you all think about these criteria, these days, and in the past couple of decades, they don't really work so well anymore. So I think probably a lot of us on this call stayed in school for a very, very long time, and that doesn't mean that we did not necessarily successfully transition to adulthood, although we may say that we have not. A lot of people are delaying getting married or having children if they choose to do so at all, with economic difficulties that are starting to get better. Finding a job had been very difficult for a while. People were moving back in with their families. All of these don't work so well in terms of thinking about them as defining when the transition is happening and whether the transition has happened. Of course, they become even more difficult when you talk about somebody with an ASD. As I will present in a little bit, and as probably a lot of you are well aware, finding and maintaining a job is really difficult for adults with ASD. Many adults don't get married, they don't have children, and many of them continue to live with their parents, and that seems to be a good arrangement for both. And so even thinking about what we mean when we talk about the transition to adulthood is a little tricky. Now in our research, we decided to take, I think maybe kind of a limited view, but a view that has shown to be pretty meaningful, in that we really focus around thinking about high school exit as our marker of transition when we talk about transition. We do this for a couple of different reasons. One is because, on a really practical sense, everybody with autism has to leave high school at some point. So it's a marker that is obtained or achieved by every person with ASD, so we can actually look at it for everybody across the spectrum. But even more than in this practical way, exiting high school is a real turning point for people with ASD and for their families. When I first started to get into this research, we were looking at how the behaviors of a person with ASD impacted their parents, and kind of threw in stage of the lifespan as just something to control for, and it came out that it was one of our most significant predictors of parental mental health and well-being. And when we asked families why, they told us that it was because leaving high school was like falling off a cliff. And what they mean by that is because of the Individuals with Disabilities Education Act, people with ASD and with other disabilities can stay in school until they're 22 years old. And while they're in secondary school, it's mandated that they receive services. But once they leave high school, there is no such mandate for adult services. And so pretty much universally, when people with ASD leave high school, parents talk about falling off a cliff in terms of their service access. They get far fewer services than they got while they were in school. Depending on where you live in the country, the degree of drop-off can be more or less. In some place like Ohio, the adult services are relatively good. There still is a drop-off for a place like Tennessee, where for many people adult services are non-existent. There can be a huge drop-off. And it is not hard to find quotes from families who talk about how worried they are about this and how difficult this is. Families from our study said things like, he lost everything when he exited high school, all the training was gone, or there's virtually nothing for my 21-year-old Asperger's son to do if he can't go to college. He's trying to fit into the normal world, but falling through the special ed crack because of his intelligence. Finally, I worry about him, where he'll be in life down the road. I worry about him financially, him gaining friendships and not being lonely. So as this came up in some analyses that I was doing, kind of anecdotally, and as I kind of looked through and talked with families and realized how salient this was, I went to the research literature and said, well, what do we know about this? What do we know in terms of what we could tell families? And the answer was not very much, relatively little. So we decided to look into that in our data. Basically, we looked at how does exiting high school impact autism symptoms and behavior problems for youth with ASD. So a lot of the data that I'm going to present today is from a study that I began working on during my postdoctoral work a while ago now at the University of Wisconsin, called the Adolescents and Adults with Autism Study. The PI of that study is Dr. Marcia Malik. We've continued to collaborate after I came to Vanderbilt, and I've ended up taking the lead on a lot of the work, thinking about the transition year specifically, but also employment and vocational outcomes. But this is a study of adolescents and adults with ASD who were recruited from the community. It's a community sample from Wisconsin and Massachusetts. The primary data collection was funded by National Institute on Aging and Autism Speaks. The reason why this data set is such a great data set to think about how outcomes change over time is because it has data collected at 7 times over 12 years in the lives of adolescents and adults with ASD. So we can actually look and see how life is changing for over a decade in these families, which is really exciting. I think in some of our first chance to get a detailed glimpse at what's actually going on. This is also a fairly large sample. Over 400 families participated at the start of the study with a pretty wide age range. The people with ASD ranged from 10 to 52 years of age at the start of the study in 1998. Particularly important for what I'm interested in, about 2/3 of the sample were adolescents ages 10 to 21, meaning that they were in high school for the most part. And by this point, all of them have left high school. So we have this pretty big sample of youth with ASD who left high school over the course of the study, which lets us look at how their symptoms and behaviors changed while they were in high school, and then whether that changed after high school exit. How did leaving high school impact how their symptoms and behaviors were changing over time, which is what we did. I'm going to kind of go quickly past this. This just is the timeline for the overall study. We have pretty similar data collection procedures from time 1 to time 8. Basically, each one of those is separated by about 18 months. Collected daily diary at a couple time points, and also other pieces of data too at different time points. But I'm mainly talking about the time 1 through time 8 data. Okay. So first we looked at how autism symptoms changed while youth with ASD were in high school, and then how that changed after high school exit. And I'm going to spend a little bit of time on this chart because I'm going to put up a few more charts that look quite a bit like it. So we looked at autism symptoms using the ADI, starting back in 1998, broke it up into the different domains of autism symptoms that the ADI breaks up autism symptoms into. And calling those different ones subscales. And what we found was that each of the subscales, so we had repetitive behaviors and restricted interests, we had social communication or social deficits, and we also had, we separated out verbal and nonverbal communication because we had some nonverbal people that didn't have verbal communication information. So we had 4 different subscales. And what we found was that on average, every one of those subscales was significantly improving while the youth with ASD were in high school. That is, the scores were going down, the symptoms were becoming less severe. This was not particularly surprising. A number of studies by this point have found that autism symptoms and also other problem behaviors tend to improve over adolescence and adulthood, and we found the same thing. However, what we also found was that that improvement significantly slowed down on all of the subscales after high school exit. And for a couple of the subscales, the degree of slowing of improvement depended on whether or not the youth with ASD had a co-occurring intellectual disability. So that's what I'm going to show here in this chart. So this is the chart for repetitive behaviors. The lines to the left of sort of I can use my mouse. There we go. The vertical line in the center represents change while youth with ASD are in high school. Lines to the right represent change after high school exit. Red line is the estimate from the multi-level models for people with ASD who do have an intellectual disability. The blue line represents the estimate from the multi-level models for people with ASD who do not have an intellectual disability. So if we go to the red line first, what we see is that on average, for a youth with ASD who has an intellectual disability, we see that the repetitive behaviors are improving somewhat over time. And after high school exit, there may be a slight slowing of improvement, but it's not statistically significant and probably not meaningful either, meaningfully different. But for youth with ASD who do not have an intellectual disability, what we see is a relatively rapid improvement in terms of their repetitive behaviors while they're in high school, but that improvement significantly slows down after high school exit, and now they're improving at the same rate as the people with autism who have an intellectual disability. So what this tells us is that exiting high school seemed to have a greater negative impact for youth with ASD who did not have an intellectual disability relative to youth who did. We also use the same types of models to look at co-occurring problem behaviors and maladaptive behaviors. This is using the maladaptive behavior subscale of the Scales of Independent Behavior Revised, or the SIBR. We had 3 different subscales. So we looked at internalizing behavior, so kind of more withdrawn type symptoms, depression type symptoms. We also looked at externalizing behavior, acting out, and asocial behavior problems. And what we found, again, was that all of the subscales were significantly improving while the youth with ASD were in high school. Not a big surprise. Again, this is consistent with other research, but that improvement significantly slows down again after high school exit, specifically for subgroups. So this chart is a little bit more complicated because not only did intellectual disability predict the amount of change, but also family income. So for now, let's just try to ignore the solid versus the dotted lines and just pay attention to the red versus the blue again. And what we see is that for youth with ASD who do have an intellectual disability, their internalizing behaviors are improving while they're in high school, and that improvement significantly slows down after high school exit. But for youth with ASD who do not have an intellectual disability, you're seeing a greater degree of improvement while they're in high school, but that improvement pretty much stops after high school exit. Family income predicts change in behaviors, but only after high school exit. So income didn't predict change while youth with ASD were in high school, but it did predict change after high school exit. Youth who came from families with lower incomes had greater reduction of improvement. Basically, their scores pretty much stay the same, or if anything, are going back up slightly relative to youth with ASD whose families have higher incomes. This led us to conclude that just like autism symptoms, youth with ASD who do not have an intellectual disability seem to be more negatively impacted after high school exit in terms of their maladaptive behaviors, but also youth whose families have lower incomes tended to be more negatively impacted relative to youth whose families had higher incomes. We also wanted to know how this transition affects families in some follow-up analyses. And when we went back to look at the literature, once again, we knew very little, except for a fair number of people had written about how this transition affects families from kind of either their clinical observations or from kind of interacting with families out in the world. Patricia Hallen is somebody who had written about this a fair amount. But what people would say is that this transition is really hard. It's really difficult for families. Basically, at high school exit, families end up really taking over finding and coordinating and arranging services and care for their son or daughter. But at the same time, services are becoming harder and harder to access and to find, and that this can be really stressful for families. And we thought this was important to study for a couple of reasons. Number one, I think it's important to understand that families are stressed just in and of its own right, but also there's some research to suggest that stressful family environments may actually put the youth with ASD at even greater risk. Research with families of younger children with ASD suggested that families are really stressed. They may be less effective at getting the services that their son or daughter needs, or delivering interventions, I think is what the study was, but it can generalize to getting services. And then at this point, there's a fair body of research in families of adults with ASD that suggests that family environments and problematic family environments really put adults with ASD at risk for behavioral declines, and positive family environments really tend to lead to behavioral improvement over time. So we wanted to look into this in our research to see how the family environment tended to be impacted by high school exit. Basically, in focusing in on the mother-child relationship. How does exiting high school impact the mother-child relationship? So the first thing that we looked at was what we call maternal burden. This is really just a measure of how hard is it, how hard do mothers report it is to parent their son or daughter with ASD in a number of different ways. And what we found was that on average across the sample, before high school exit, parents were reporting that burden was going down over time. It was getting less hard to parent their son or daughter. But then after high school exit, burden was going back up at the same amount. And you can look here, and the differences aren't huge on average, but they certainly are statistically significant. And it's consistent with some of our other findings. Then we looked at how close mothers reported feeling to their son or daughter with ASD, and the degree to which families were getting their service needs met was an important factor here. So for families that said, you know what, we're really getting most of our service needs met, they had low unmet needs, leaving high school really didn't impact the mother-child relationship at all. The mother-child relationship was going up, was getting better, improving while they were in high school, and improving at the same rate after high school exit. But for families that said, you know, we have a lot of service needs that we are not getting met, then after high school exit, we saw that improvement in the mother-child relationship was significantly slowing down over time. And then for the amount of warmth in the mother-child relationship, we saw a similar pattern to what we had seen in the behavioral development, where for youth with ASD who didn't have an intellectual disability, we were seeing improvements in warmth while they were in high school, and then declines in warmth kind of at the same rate after high school exit. We were seeing less change from before to after high school exit for youth with ASD who had an intellectual disability. Okay, so to sum up this section, this led us to conclude that indeed, at least in terms of behavioral change, leaving high school did seem to be a significant turning point in the lives of people with ASD and their families. And although, to my knowledge, this was really one of the first studies to show the impact of leaving high school on behavioral change in this population, it was by no means one of the first studies to show that transitions are difficult for people with disabilities, including people with ASD. Just one of many examples I could have pulled out is by a colleague of mine, Anna Espenson, who found that for adults with intellectual disability, after they experienced transitions such as moving out of the parental home, they had a worsening of their behavior problems for a time. So I think our studies suggest that leaving high school is another such disruptive transition in the lives of people with ASD and their families. We wondered whether the reason why we saw slowing of improvements, and in some cases stopping of improvements in behavioral development after high school exit, was because the young adults with ASD were having a hard time finding some sort of stimulating appropriate vocational activities. So we decided to look into that and very carefully coded the vocational activities of the adults with ASD in the study after they left high school. And let me start here at the 12th position of the pie chart here. So if we start with the royal blue through the green, this is the percentage of adults with ASD in this Wisconsin and Massachusetts study who were primarily spending their days out in the community, about 25% of them. If we go to this next group here, about half of the adults with ASD were primarily spending their days in sheltered settings, in sheltered workshops or adult day centers. Some of them are getting out in the community a little bit, doing some volunteering or a little bit of employment kind of usually with the other people in their day program, but most of them actually weren't. They were spending pretty much the whole days in sheltered settings. Then the last quarter of the pie here are the people with ASD who are basically doing nothing. They may have been going to like a day center for a couple of hours a week, but really doing very, very little in terms of day activities. So this led us to suggest that, in fact, yes, adults with ASD have great difficulties obtaining community employment in this sample, and that may have something to do with why we see slowing of improvements in their behaviors after high school exit. We saw less improvement after high school exit for those who did not have a comorbid intellectual disability. And at the time when we first found this was really surprising to us because it was the opposite of what we would have expected from the extant research. So a number of studies at this point have looked at kind of employment, independent living, social outcomes for adults with ASD. And what they tend to find across the board, and not surprisingly, is that if the adult with ASD doesn't have an intellectual disability, if they're higher functioning, which I'm putting in quotes here, that they are more likely to be living more independently, working more independently than people with ASD who have an intellectual disability. Again, not a big surprise, but we wondered whether perhaps there was a subgroup of people with ASD who don't have an intellectual disability who are having a very, very hard time qualifying for any types of services or finding the right services to support them in whatever vocational pursuit they chose, mostly because most of our adult services are really geared towards people with an intellectual disability. And we wondered whether we might be seeing a greater number of people who were out in the community, but perhaps also a greater number of people who were doing nothing. So we decided to look at that. This is just a smaller sample. So this is just pulling out a group of people with ASD from this larger study who had just left high school and looking to see what they were doing with their days. And we separated them by people who did and did not have an intellectual disability. So first, if we look at the people who do have an intellectual disability, the green slice of the pie here suggests that the majority of them are spending their days in sheltered settings, either the activity centers or sheltered workshops, kind of segregated settings, not in the community. And about 8% of them were doing nothing. Now, if we look at the people with ASD who don't have an intellectual disability, we can see that just about half of them were in some sort of post-secondary program, which is great. but about a quarter of them had no activities at all. They were pretty much doing nothing. And this is in Wisconsin and Massachusetts, where the adult services may not be great, but it's particularly in Massachusetts, they're pretty good. I would imagine that if we did this pie chart in Tennessee, this red slice of the pie would be much, much larger. But anyway, I think the take-home from this is that, in fact, although the youth with ASD who didn't have an intellectual disability were much more likely to be in college and were getting a competitive job, they were also much more likely to be doing nothing after high school exit, which is maybe why we see a greater slowing of improvement for them after exit. Okay. The other thing that I think I must have taken out of the presentation, but I just want to mention, is that we only saw an impact of family income after high school exit. Income never predicted change in behaviors while youth with ASD were in high school, only after high school exit. And I thought that that was sort of an interesting thing, that once people with ASD leave the protective umbrella of the Individuals with Disabilities Education Act, or IDEA, that seems to be when family income, at least in this study, had a greater role in service access potentially. Okay, so now we'll move on and think about kind of going on throughout adulthood and throughout the lifespan. Thinking about what are the challenges faced by individuals with ASD throughout adulthood, particularly in terms of vocation, and then do difficulties at transition signify a momentary perturbation or a shift in trajectory? And I'm going to talk a little bit about what I mean by that. So in developmental psychology, there are a number of ways that you can hypothesize or conceptualize that a person can be impacted by a transition or a disruptive event. One is a momentary perturbation, and I'm trying to, I apologize for my pretty crude graphics here, but hopefully they'll get the job done here to illustrate what I'm trying to show. So a momentary perturbation would mean that things got kind of crazy or things were difficult for a period of time, but as you went on, things kind of righted themselves. So basically, let's say the person with autism is in high school, and we see this line going up. Things are improving, 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 and things are going pretty well. And then they leave high school, and we see improvement stops. In fact, maybe even things get worse for a while, and things kind of bottom out. But as time goes on, people find their way, and people find their place, and maybe a good vocational placement, or finding the services that work well for them, and eventually we see a resumption of the improvement that we had seen while they were in high school. So that's kind of what a momentary perturbation would signify. And that's a really different idea than a shift in trajectory, where we would see improvement, 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 improvement while they're in high school. And then after high school exit, that improvement basically stops. Maybe we see a decline, maybe we just see kind of just stagnation over adulthood. If, indeed, when we look at change over time, we see that high school exit is a momentary perturbation, yes, we're probably still concerned about the transition to adulthood, because it's not good to see growth stop, and it's not good for things to be in turmoil and for families to be in flux. But if we know that if we wait over time, things are going to resume, then maybe this is a little bit less concerning than if we know that for the majority of people, or for the average, growth and improvement is going to stop after high school exit. So we decided to look into this, really just only thinking about employment and vocational outcomes. Oh, and I'm just going to go through this quickly, but there is some research evidence to suggest either one of these hypotheses. So this is a paper that I got to play a relatively minor role on, that's headed up by Paul Shattuck, using a national database. But what he found was that the longer that somebody with ASD, for people with ASD who are out of high school longer, they were more likely to have worked or been in school at some point in time. Now, it was cross-sectional. It didn't follow people over time. But this might suggest that as time goes on, people find their way and find something. However, a number of other outcome studies that have been done, again, cross-sectionally, but with people with ASD throughout adulthood, suggest that no matter when you're looking at in the life course of adults, you see low rates of employment, low rates of friendships, high rates of living with parents, and overall poor outcomes. And that would suggest that, indeed, poor outcomes persist throughout adulthood. So we decided to look at that, and we decided to look at that using something that we call the Vocational Index. And I'm only going to spend a minute on this, but I actually think it's a pretty good way to try to measure vocational activities in adults with ASD. So I'm happy to share how we come to this index and what questions we use to get that, if there's anybody who's interested in thinking about really classifying and understanding vocational activities. But basically, to develop this index, we sat down with transcripts from all of the adults with ASD, so about 300 of them total, over all the different ways of the study and tried to come up with some sort of way to take each person's sort of individual ways that they were spending their days and put it into some sort of index with a limited, finite number of categories, mutually exclusive, that could be replicated. And it was a bear. I mean, it was a beast to try to do this because it seemed like every single adult in the study was doing some sort of different combination of things. The amount of turnover in activities was just incredible. It was very, very difficult. But finally, we came up with an index that we feel pretty good about and that we think it really meaningfully captures what's going on in the lives of adults with ASD. We ended up with 9 categories, going from least independent to most independent in terms of the amounts of supports that are required. And then we also wanted to throw in the number of hours to some extent. That is, if somebody was doing activities for less than 10 hours a week total, we felt like maybe that was kind of a different ballgame than somebody who was doing activities for a greater number of time. So highest scores would go to people who were employed in the community without supports or in a post-secondary degree-seeking program. Lowest points would go to people who were doing nothing, and then kind of gradations in the middle. So we used this index. We applied it to each of the adults with ASD at each of the waves, and then looked to see how scores on this index changed over time, over 10 years of the study. So for this first round, we picked out mostly adults with ASD who had an intellectual disability, about 160 of them. These were all people who were out of high school at the start of the study. About 81% of them or so had an intellectual disability. And we looked to see how their scores were changing over time in terms of their independence. And what we found was that on average, vocational activities were becoming less independent over time. So in the pie chart, the first group here shows, it basically takes the slope scores that we get from our multi-level models and just looks to see whether they're positive or they're negative. It's pretty much impossible that someone's going to get a slope score of 0. And so everybody's going to get coded into either declining or improving. And when you do it this way, about 75% of the adults with ASD had slope scores that indicated decline, 25% indicated improvement. We thought that this was maybe not the most meaningful way to do it because, for example, if somebody had a slope score of negative 0.000001, that was going to get coded as a decline, but in reality, that was probably no change. And so instead, we looked at it another way and took the slope scores and said, okay, if they are declining or improving by at least 1 category on our scale, if not more, then we'll consider that to be substantial change. And when we did that, we actually saw a massive amount of stability over time. About 80% of them had scores that were within 1 category over the 10 years of the study. But when we did see change, it tended to favor decline. And in fact, we saw very little evidence of improvement over time. In terms of what predicted vocational independence at the start of the study, it was sort of your usual suspects. So if the youth with ASD, or if the adult had an intellectual disability, they tended to have less independent jobs, or if they had more behavioral difficulties, more autism symptoms. Our service variables didn't actually predict initial. So if somebody was getting more services or had fewer unmet service needs, they weren't necessarily doing something that was more independent at the start of the study, which we thought was sort of interesting. But only one factor predicted change in vocational independence over time, and that was actually the sex of the adult with ASD. So when we divided and when we looked at change over time for males versus females, the blue line represents the males, and what you can see is that there looks like there might be a little bit of decline, but that's actually not even statistically significant. You can really think about that as no change, stability, in terms of how independent their activity is over adulthood. For females, we saw significant decline by over a point on average, in fact, almost up to 1.5 points, a much greater decline than what we saw from males. So that led us to wonder what we would think and what we would see if we looked at patterns of employment for adults with ASD who didn't have an intellectual disability. So those earlier analyses were primarily adults with ASD who had an intellectual disability. The majority of them, the vast majority, in fact, were spending most of their days in sheltered settings. So what would we see if we looked at adults with ASD who didn't have an intellectual disability? So we pulled out 73 adults with ASD from this sample. We looked at data on their employment and post-secondary education at up to 7 time points over 12 years. Because people with ASD left high school at different times throughout the study, some people had more data than others to look at this. We only included people in these analyses if they had at least 3 time points of data. We thought if you're going to look at patterns, you should probably have at least 3 time points. And so we took these adults and we grouped them into 3 different categories. So first we looked at the people who, at every time point that we had data for, they were either working in the community without supports or they were in a post-secondary educational program. About a quarter of the sample fell into that group. The next group were people who, at some of the time points, they were working in the community or in post-secondary education, but at other time points they weren't. And that was about 43% of the sample. And then the last group were never employed or never in post-secondary education. And that was almost a third of the group who had never done that. So I guess what I want to bring your attention to here is that having employment in the community or being in a post-secondary program is relatively common. About 2/3 of this sample of adults with ASD without an intellectual disability were doing that. But maintaining those activities over time was relatively rare, less than a quarter of the sample. We saw this gender effect again, which I thought was really interesting. So again, this is our consistently in activities, sometimes and never in activities, broken down by gender. And if we look at the consistent activities, what we can see is that about 30% of the men are consistently in employment or post-secondary education at every time point of the study. None of the women, I mean, not one of them, were. Now we can make the argument that there are fewer women than men in the sample. There were, I think, about 23 or 24 women and 50 men. But still, to have not a single woman who was consistently in post-secondary education or in employment, we thought was pretty striking. And when we looked at whether they were in employment or post-secondary education, just at one point in time, there was no difference between the women and the men, at least not statistically significant. So, and that was actually the case in the earlier analyses too. When we looked at employment at the start of the study, in our vocational index, there was no difference between the women and the men. It was just when we looked at change over time, we see a similar finding here. I should also note, and I should have said this before, that we, in both of these different subsamples, we looked to see whether the women were different from the men on just about every single variable we could think of. Many, many, many indices of behaviors, autism symptoms, behavior problems, daily living skills, comorbid disorders, psychiatric symptoms, also a number of family variables, family income. I mean, just about every single thing that we can think of. In the first analyses, there was not one statistically significant difference. In this set of analyses, I think one of the subscales of daily living skills was marginally less for women than for men, and about 30 or 35 of the variables had no difference. So these, I think, relatively large differences that we're seeing in terms of employment patterns over time for women do not seem to be accounted for by differences in behavioral development. Okay, and I'm going to say a little bit about what I think that could mean. So I think what this is telling us is that difficulties after high school exit that we saw in our earlier set of analyses that I presented do not seem to be a momentary perturbation. It's not like if we wait things out, things are just going to get better on their own. In fact, these difficulties maintain and might even worsen for some people throughout adulthood. Even for adults with ASD who don't have an intellectual disability, maintaining a job or an educational program is really difficult. Only 25% of this sample of higher functioning adults were consistently in a competitive job or PSC. I should also say this is consistently in any competitive job or any sort of post-secondary program. We haven't even gotten to the point yet where we're looking at holding one job over time. This is just holding the same type of job, but it could be a different job at every time point, just the same type. So the degree of instability is going to be even larger than what we are seeing here, looking at it in this way that's a little bit more crude. We're not really finding sex differences in obtaining a vocational placement, but instead in maintaining that placement over time. We saw similar findings for different subsamples with and without ID in looking at vocational activities in different ways and still coming to the same conclusions. We don't really know why. We're not really seeing differences in any of the variables that we have measured in the study in terms of why we're seeing these differences for women, but we have some ideas. We wonder if perhaps there are the different societal expectations that women have in the workplace, kind of across the board, and typically developing populations are also present for women with ASD, and specifically maybe it's less okay for women to have social difficulties than for men. There might be greater expectations for women to be social, and for women with ASD who have social impairments, that might be a particularly difficult hit. Perhaps parents have different expectations for their adult daughters as opposed to their adult sons. Maybe if a job placement doesn't work out, parents might be more likely to get their adult son out there quicker, might be less likely to kind of let their daughter stay at home and figure things out. We don't know. These are just speculations. There actually may be some differences in terms of the choices, the job choices that women with ASD have rather than compared to men. They may be choosing jobs that have a greater social load. Some of these jobs that would be kind of typically female jobs. Again, this is something that we actually have some data on that we can look into. Or maybe even though we hadn't seen differences in the behavioral variables that we looked at, there could be more subtle phenotypic differences between women and men that might be impacting their ability to maintain a job over time. Oops, let's see.
Julie, I just want to be cognizant of time.
Yeah.
I didn't know how close you were to finishing up, sorry.
Yeah, that's okay. Let me say one more thing, and then I'll be done.
Okay.
And I'll just go through it really quickly. But our most recent research actually suggests that, let me just go to this slide here. If you put somebody with autism in a more independent vocational setting, you actually see improvements in their autism symptoms, in their behavior problems, and in their daily living skills over time. So basically what we wanted to know is, okay, so we see vocational difficulties. Does that really matter? And our research suggests that, in fact, if you put somebody in a more independent setting, you do see behavioral improvement subsequently after that. And the opposite direction of effects is not statistically significant. So what that leads us to suggest is that, in fact, and this is not so different than what you see in typically developing populations, if you put somebody in a job placement that's a good fit for them, then you may see behavioral improvements over adulthood other than that. And that's really the last thing that I wanted to say. And so we can move on to the next person.
That's great. Thank you so much. And I'm sure we'll have a little bit of time for questions. I just wanted to go ahead and let Dr. Kuo just speak briefly, if I can get to the transition network slide right here. Dr. Kuo, are you?
Yes. Hello. Can you hear
Okay.
me?
Hi. Yes.
Hi. Thank you so much. I found that a fascinating presentation and really the type of research that needs to be done for this population to understand better how to support these young adults as they transition from high school into post-secondary education or employment. I just wanted to make a note, given today of all days, it's the 5th anniversary of the passage of the Patient Protection and Affordable Care Act. And so with the passage of the ACA 5 years ago, young adults are able to stay on their insurance, on their parents' insurance until age 26. And for those of us working in healthcare transitions, that has been huge. As you know, previous to that, a lot of young adults would be dropped from their parents' insurance at 18 or 21 or some age, and oftentimes not be eligible for employer-based insurance, which is what 80% of neurotypical adults have in this country. And so, you know, the challenges with employment, I think, are particularly important given the fact that employment is pretty much your access to health care. For individuals with autism with intellectual disabilities, they most likely will qualify for some sort of disability insurance, you know, SSI, which then qualifies them for Medicaid. And then some parents have the type of insurance that for a disabled adult child they can stay on for life. Without an intellectual disability, I think adults with ASD have a much more difficult time. And here, you know, employment is a marker for so many things beyond just access to health care. Employment also allows you to pay into the system, and so after 40 quarters, you are then eligible for Social Security and Medicare. And so long term, you know, employment is definitely desirable for adults. However, transition, I think, from a healthcare perspective, still needs to look at kind of comorbid conditions associated with ASD. So in the childhood population, we see a lot of GI and sleep issues. Overwhelmingly in the adult population is comorbid psychiatric issues, mood disorders such as anxiety and depression. And so in addition to access for adults with, in addition to access to primary care, mental health care is a particular problem. And so finally, with healthcare transition, finding a primary care provider who is comfortable taking care of an adult with ASD, possible behavioral symptoms, with or without an intellectual disability is an increasing challenge. And as Dr. Taylor alluded to, there are more and more children graduating high school, you know, an estimate of 63,000 a year with ASD graduating, and so these adults are going to be looking for adult providers. So just wanted to put a plug in for our new Healthcare Transitions Research Network, which was funded by the Maternal and Child Health Bureau in September of 2014. And we are seeking to encourage research in the field in this area. We have a network design meeting in May 2015 in Washington, D.C., and I have some information there as far as our program manager and contact info. I'm not sure how to get to the next. Could you advance to the next slide? So this is our website. It's basic right now, but we're hoping to populate it and start monthly newsletter. And so the web address, which was on the previous slide, is www.autismtransition.net. And we look forward to hearing from anybody with questions. And I think that's it.
Wonderful. Thank you so much. I'm not sure if Dr. White is able to speak. We're having some technical difficulties. But I'll just go ahead and mention that Dr. White is with the GOT Transition, which is the Center for Healthcare Transition and Improvement. So this is their website. And did anyone have any questions for any of our presenters?
I do want to thank our presenters today. Very stimulating presentation by Dr. Taylor and wonderful comments from Dr. Kuo as well. And I hope that all of our attendees today got as much out of it as I did. I saw that somebody asked about copies of the slides that we had to skip through, and they will be made available to everyone afterwards. The link to accessing those will be coming to you along with an evaluation form for CME credit if people want to apply for that. Any other questions or comments from our audience? If not, then I want to again thank our presenters today for a wonderful webinar, and I hope that everybody has a wonderful rest of your week.
Thank you.
Thank you
Thanks,
all so
folks.
much.
Bye now.
Okie dokie.